Hello, my name's Steve Macfarlane. I'm the Chair of the Faculty of Psychiatry of Old Age within the College. I work as Head of Clinical Services for Dementia Support Australia, a national organisation that provides multidisciplinary dementia behaviour management services around the country. I also conduct Alzheimer's disease clinical trials and spend a day per week in private practice. Psychiatry during the time of COVID poses a number of challenges. First and foremost, I think we need to keep in mind our responsibilities to our patients. We need to maintain a service in these times of a global pandemic. Those of us who work in liaison settings have an additional role in supporting our colleagues on the front line within acute health services. In relation to older persons, as we know, major risk factors for mental illness at any age include loneliness and social disconnection. The elderly were thus already an at-risk population even prior to the pandemic, now more so during this enforced period of social distancing, both for older persons living at home and more particularly for those living in residential care. For vulnerable groups with identified illnesses, regular supportive contact with a mental health professional can be invaluable. I'd encourage you all to explore means to maintain contact with your patient population during this time, including via the provision of telehealth services. Servicing our patients in residential care can prove particularly challenging. We've heard stories of care providers imposing periods of isolation on those who leave a facility to attend external health appointments. This will only serve to further isolate and stigmatise those with mental health conditions. On this point, the Council of Presidents of Medical Colleges issued a public statement targeting residential aged care providers on May the 1st, emphasising that such measures are unnecessary for residents attending external medical appointments and that residents should continue to be allowed to receive visits into residential care from medical specialists and general practitioners during the time of the pandemic. This view is supported by the official Commonwealth guidelines. We're all aware of necessary infection control procedures, and as long as these are followed, there should be no additional risk to either doctors or residents. For those of us who work with the elderly, there are a number of things we should all be doing. From May the 1st, aged care providers will only admit those who can provide evidence of immunisation against influenza. This is not unreasonable, given that those of us who work with the elderly should be receiving this immunisation anyway as a matter of routine. Consider taking a photograph of your immunisation certificate and keeping it on your phone, as you may be asked for evidence of immunisation prior to being granted entry into a facility. Most providers are now providing hand sanitizer stations throughout their facilities. These should be used frequently during your visits. Some providers may ask you to wear personal protective equipment during your visits. These requests are not unreasonable if the nursing home is providing these for your use. Being seen to do the right thing within a facility will help decrease the anxieties of both residents and staff. Reassure patients who continue to attend your rooms that touch points are regularly disinfected, make hand sanitizer readily available, and enforce social distancing within your waiting rooms. Consider making masks available for patients to use and having patients remain in their cars until their appointment is ready to commence. You can use a receptionist to call them in by phone from the car park at that time. Also, consider that your most vulnerable elderly patients may require increased support at this time. Consider increasing the frequency of their review appointments, even if this is via telehealth, for those most in need. Please lead by example during these times and continue to offer residential inreach services during the pandemic. The risks are very low if the right precautions are taken. You and your work are valuable, but your own health and well-being are also critical. Don't neglect your own health needs. Stay connected with friends and family and use your peer review groups and the resources provided by the college, available on the website, for additional support during this time. Stay well, and thank you all for continuing to do what you do.